for this webinar today. And before we begin, I would like to acknowledge the traditional custodians of the lands on which we're all meeting today. I'm joining you from the beautiful lands and waterways of the Kombu-Meri people, and I extend my respects to the elders past and present, as well as the elders of all the lands from which each of you are joining. So this webinar through the Emerging Leaders Network is brought to you by the Prevention Center. And just for those of you who are new to us, this is a network of early to mid-career researchers, policymakers, and practitioners who are all working in chronic disease prevention across Australia. And our goal really is to cultivate a dynamic and enduring future prevention workforce that has the capability to drive the co-design of applied and policy relevant research and really translate and mobilize knowledge for policy and practice impact. So just a reminder that this session today is being recorded, and we are also going to enable the question and answer session later on, so you can use your chat function or you can switch on your microphones and cameras later on when that kicks off. So a bit about today's webinar. Today we're focusing on leveraging the influence of politics and policymaking in prevention. And through this webinar, you will gain insights into navigating and working within existing policy cycles and identifying opportunities to amplify the impact of prevention efforts on population health and well-being. So to learn more about this, we are joined today by our honorable guest speaker, Carmel Williams. Carmel is the director of Centre for Health in All Policies Research Translation based in South Australian Health and Medical Research Institute and the School of Public Health at the University of Adelaide. She's also the founding director of the WHO Collaborating Centre for Health in All Policies implementation, and owing to Carmel's extensive experience in the field of health promotion and public health, she was awarded full academic status with Flinders University at the level of associate professor, and has also recently been appointed as a visiting research fellow at the University of Canberra. So welcome, Carmel, and without further ado, it's over to you for the presentation.
Thank you very much, Michelle. Thanks to you and the lovely TAPSI team for inviting me to share some of my thoughts and some of the ideas around how we can work within the policy making field to really improve the impact of prevention. Like you have, I would also like to acknowledge, oh, my slides aren't moving. Oh, here we go. I'd like to acknowledge where I'm meeting and speaking to you all from today. I'm sitting in the beautiful Greater Adelaide Plains, the lands of the Kaurna people, who are the traditional custodians of Adelaide. And I want to recognise their ongoing connection to land, waters and culture, and pay my respects to their elders past and present. And as I often like to do when I'm dealing with my students through the university, I like to acknowledge that the lands of the Kaurna people were never ceded and that they still have a connection, sovereign connection to these lands. And I thought I would just tell you a tiny little bit about the centre. You may not be familiar with it. The centre is really a multi-institutional centre, very similar to TAPSI in that regard, but it has a strong focus on working with policymakers and academics, really thinking about linking the work of the academic community and how that can be brought together and influence and shape the policy and decision-making process. So today's presentation really sort of draws on the kind of core functions of the centre's work. We also really have a very strong focus on social determinants of health and looking at how we can translate what we already know about how to improve health and wellbeing outcomes through acting on the social determinants of health, how we can amplify that and make that delivered through healthy public policy more effectively. So I just thought I'd touch on that briefly. But what are we going to be talking about today? So I will start with talking a little bit about policy and policy making, providing a few definitions and providing a bit of context. And then I'm going to talk about why it matters and how and why it's so critical for us in the prevention field. And then we'll talk a little bit about the different examples of policy, how it's operation, and a little bit of discussion around how those different forms have been applied to the prevention space. And then I'm going to talk through and provide a bit more detail around the principles that can really guide how we use policy to influence prevention outcomes, and then go through a couple of those examples. There's several, but we're going to be talking about health and policies, which is sort of my area of knowledge and expertise, but also research translation. But to start today, I just wanted to be clear about what it is that we're talking about when we're talking about prevention. And please excuse me, because I know you're all working in the space and you will all know this. But I do think it's really important to be sure that when we're talking about prevention, we're talking about the full breadth of prevention. And my interest in particular is in primordial prevention, which is really addressing those wider determinants of health by reducing the environmental factors, hazards that negatively impact health. And it's really primordial and primary prevention where we need to be really working across the policy field in a very intensive way and a more explicit way. But of course, policy plays a really important role in secondary, tertiary and quaternary prevention as well. But I just wanted to set that scene that I'm going to be really speaking today mostly from the primordial prevention and the primary prevention perspective. And then why does policy, just a little bit of an outline, this sort of demonstrates that actually really many of the gains that we've been as a prevention community being able to deliver to our societies over time have really been, have really involved policy change. And, you know, this is just a few examples. If we think about motor vehicle safety and the introduction of seat belts, many of the tobacco control initiatives, the strategies around protecting maternal and child and infant health. And then on the right hand of the diagram, you can see how public health successes, this is a Victorian table, have really been allocated, and how important policy has been at every step across all of those areas. So even policy around eliminating cervical cancer, you know, policy's been instrumental at every step along the way. And so I think it is very important for prevention, people working in the prevention space to take the time to understand policy and policy making, and to be aware about how we can use it to really improve the health and wellbeing and address inequities within our communities. So to start with, let's think about what we mean when we say policy. Policy is a really opaque term. It's actually hard to define. Simply, it's really a course of action that is made by a government, a political party, a business. Any institution will have policies that they'll follow. Universities will have them, schools will have them, you know, primary healthcare services will have them. So, you know, policies is really a plan about how to address a problem or guide action. And you can see here, Walt and Gibson have provided the policy triangle, if you like, that actually whenever you think about policy, regardless of what institution you are, you really need to be thinking, taking this triangle into account. So you need to think about the context. What's the context in which the policy is being made? So if we reflect on changing context, you know, changes in political government, a government will actually perhaps change the context of how policies are made. If we think about New Zealand and the changing government that's happened there over the last few months, and how their treaty, Waiparinga Treaty, is now being challenged, and the policy intentions around that are being questioned. That's because the context has changed due to the political drivers of the new government that's come in with a different political ideological agenda. Then the second part of the triangle is content. So what is it that you're trying to do? What is the problem? How are you framing the problem? And what is it that you're hoping to put forward as a solution through a policy process? And then, of course, the process you use. So is the policy going to be decided by the executives or the leaders of the institution in a closed room, or is the process going to involve consultation with stakeholders? And of course, in the middle of the triangle are all the different actors who have a role to play. And at the heart of this, I think, is really trying to highlight that at all of these areas, a political dimension exists. If we build on this and provide a few more definitions, it's a simple plan. A policy is a simple plan that's really focused on goals and determining procedures. It's really a way in which people actually decide what to do. So as I said before, local government, multinational companies, local businesses, schools and hospitals all will have policy. And then it's really how the policies are initiated. It's important to think about the policy process, which includes initiation, what gets on the political agenda, what becomes a policy, how they're developed, how they're negotiated, communicated, implemented, and evaluated. And, you know, often policies aren't evaluated. So it's obviously something for us to be thinking about in the prevention space. But if we move on and move away from just thinking about policy, we start to think about public policy. Public policy is really what governments do. So, and any public official, it doesn't have to be ministers and premiers and prime ministers. It can be any public official. Bureaucrats within public administrations make policies all the time. And it includes what the government decides to do. But importantly, it's really important to think about this. It's also what they decide not to do. And a really good example of a policy that was taken, that was delivered by the previous government, by the Liberal Party when they were at the federal government, when they were in power, was that they had a policy not to act on climate change in a really concerted way. And so that was the decision about what not to do. And these things are really important when thinking about how to influence policy. We need to be thinking about what governments are deciding to do. And if they decide not to act on it, then the course of leveraging and influence we can have in that space, we have to take a different tact. So being aware of those things is really important. And here you can see that really for governments, public policy is a way that they make a decision on behalf of the public. In a democratic country like Australia, the government is making policy and public policy on behalf of its citizens. And the diagram on the right really describes the relationship between government and its citizens, and it shows how important the feedback loops are in the process. And I can talk a little bit more about that as we move forward. But I think it's really important to think about public policy, and it goes back to my point earlier that it's a bit opaque because it doesn't necessarily have a clear beginning or a clear end. It's certainly not a linear process. And that actually, therefore, it's really hard to decide at what point and how to intervene and influence it. But getting to be more familiar with the policy cycle and the policy process can be helpful. It's also that different people will benefit from the policy decisions. Inherent in public policy making, there tend to be winners and losers. And so for governments, they have to weigh up the impact of those people that might lose out with a public policy. And I think that's a very important element for us to be thinking about in the prevention space. Many times the things that we're wanting to see changed using policy levers will have winners, will have losers who will advocate and argue strongly against our strategies. And of course, I know you're all very aware of that, but I think it's really important to understand that. And then, of course, it's important that the community is engaged and we're thinking about this. Governments are thinking about what the community wants and how the community will, whether they'll support these policy changes or not. And so public policy making, to summarise, is really about problem solving, and it's shaped by institutional, so governments, political parties, economic and other context. So the economic is obviously big business and other considerations, the consequences of a policy decision. And of course, the interpretation of these public policy documents will vary depending on whether you're a private or a public actor, and you have different views around how these policy solutions are being cast. I think a classic example would be the gambling issues that were recently and are continuing to be debated amongst our public health colleagues, and how the government has really walked back on taking a very strong stance around gambling due to these competing interest and alternative motivations from the private actors. And at the heart of public policy making is recognising that policy making is inherently political. And this is very important for those of us working in the prevention space. Oftentimes I hear people saying that they don't want to engage in the political process. They don't want to be involved in partisan politics. But as a prevention professional, if you don't take the time to understand the political motivations of the organisations you're trying to influence, such as government, local, state, federal government, and you don't understand how they're being shaped and pushed around and forced or influenced by other voices, then it's really difficult for us to get the agenda forward. And we all have many of those experiences that we could describe. And so this next slide I really like, because I think it speaks to the issue of framing and how we frame a problem and how we frame a solution. And whose voice is loudest in that framing. So governments in the public policy making process often respond to the loudest voice. And so here, this diagram, you can see that the problem was described in various ways, and so then the solutions look completely different. I particularly like how the customer was billed, which is in the bottom middle section. And really, what was required to solve this problem was a simple swing on a tree trunk. So being clear about how the issue was framed and how it speaks to the audiences you're trying to influence, and in this case, that would be government, is really something that you need to take the time to consider. Would it be better to adapt the proposition to government around a policy change so that it aligns with another political agenda that they're trying to pursue? So take the time to think through how you might be able to go about framing your issue. And so policy matters because it's really it's the instrument of modern societies, and it's how governments exercise their authority. And the outcomes include not just what we're going to do and why it's important that we do that, but how we do it. So policy really influences government's approach to allocating budgets and resources. And so this is really critically important in terms of prevention. You know, I think you all will have seen probably the Public Health Association and the Australian Health Promotion Association position statement, which is calling for governments to invest 5% of the health budget into prevention. And so we don't have that yet. And so we need to keep advocating for that. But the government's policy decision not to do that, not to shift resources from the health system, the acute health system, to prevention, is a policy political decision. And so you can see how it directly influences the implementation and ability of prevention to be able to do the work it needs to do. And I think just to sort of summarise this part is really that by understanding how governments decide to act and being able to think about how we can influence them really gives us a whole set of additional levers that we can use to shape and influence public health outcomes. And so to talk through how policy is made, it's usually a cycle. And if you look here, starting at the bottom, it talks about that issues are identified. And they can be identified through a number of sources. How do they get onto the policy agenda? How does an issue emerge and become onto the policy agenda? The role of non-government institutions and academics in this space is really important. Governments can identify new problems themselves, but I think they're much more likely to be reactive and respond to issues that are identified through through media, through academia, and through the community and non-government sector. Some examples of issues that have emerged in recent years onto the policy agenda is the issue of loneliness, and how loneliness is really important and now is considered a risk factor for health and well-being, the same as smoking 15 cigarettes a day. Well, 15 years ago, we weren't talking about loneliness and social isolation. So that's got on the agenda through a range of different mechanisms. And then you go through the process. I won't read all of the steps out, but it's basically doing an analysis, which is looking at all the different evidences, all the different influences, coming up with a decision around what sort of process, how you want to act, then determining the instrument, and then implementing and evaluating. But I think the policy-making process, and I know I'm saying this a lot, but I don't want to I think it's so critically important to recognise it. It's really a fraught process. It's really a struggle over ideas. So different actors who are going to be the winners and the losers of the policy solutions will have different views around how to solve the problem. And so this struggle over ideas really requires us as prevention professionals to think about how we can engage in this negotiation process about helping to support the struggle over ideas and to see that prevention is a stronger winner, has a stronger focus and a stronger influence over what ends up being finally decided. At the heart, policy and evidence does play a role in policy, but sometimes it's not as important, or actually oftentimes it's not as important as people's political belief systems. How they believe the world is constructed, how they believe things can be done. And so if you have a political belief system that is about individualism and that government should have a small footprint in society, then you're less likely to want to engage in kind of rigorous policy processes, putting laws and regulations on society. But if you have a political belief system that has a stronger communitarian kind of focus and a really strong equity focus, then you may be more inclined. So these things really play out significantly in how policy is decided by governments. It's really an interplay between the role of the state, which has the best interest of the citizens at heart, but how they intersect with the market, the economic forces, that all governments want to have a thriving economy, and then also how the individual and family rights and view the solutions. So it's this interplay between all of these things and the political belief systems of the decision makers that really shape what policy solutions are put forward and enacted. But this is really what the policy cycle looks like. It's really messy. All of these lines are evidence-based. This is an international example of a policy process really for low-income and middle-income countries, but I think it completely aligns with the way that policy is done in Australia, and it just demonstrates, it really highlights the messiness and the fraught nature of making policy decisions and the tensions between different aspects and different players. Here, I just wanted to show you an example. Again, another evidence-based flow diagram. You all will be familiar with this, I'm sure. This is the Forsyth's obesogenic environment diagram. But if you think about, you're a government agency and you're trying to address the challenges of growing rates of overweight and obesity in our society, it's difficult for you to be clear about where to act when you map out the evidence like this. you can see the complexity of that there are multiple parts of the system that are shaping and influencing the obesogenic environment in which our citizens are living. And so, you know, it's a bit, it can be a bit overwhelming for governments to know how to act. And so therefore the prevention community, which I think we do very well, really needs to provide quite clear guidance on which bits of these issues we think can be really successfully and meaningfully make change for the community. So examples would be obviously sugar sweetened beverages, and of course the move towards reducing junk food advertising for children on media and exposure. So to talk about the policy instruments, so there are many different instruments that governments can use. Laws are kind of the hardest instrument, you know, acts of parliament. They can then be supported by regulations. The actual provision of services and programs. So much of our work is about program, but what services are funded by the government and what services aren't is definitely a policy decision. And then funding for infrastructure like roads and third airports in Sydney, those sorts of things. And here in Adelaide, we've had lots of funding for our north-south corridor. So that's a statement about what the government sees as important. So these are all really important instruments. Choosing which instrument to use takes up quite a bit of time. Governments tend to be hesitant to use legislation unless there's a critical need to do it. And so they'll often take the softer options as a first port of call. But any instrument will have costs and benefits, and there will need to be community and political acceptability for moving forward. So that's one of the reasons legislation tends not to be the famed, and regulation not to be the famed policy lever, because we often don't get the political buy-in from the community, and there's not the acceptability. And then there's also implications for timing and implementation. So when policy instruments are chosen, obviously it needs to be a method or a tool that can achieve the policy objectives. And it needs to support, it needs to be relevant to the time. So is this, you know, sometimes governments are really looking to make significant change and to put really strong legislation in place and to secure that for the future. So then if that's the time, then that's when the instrument should be chosen. But all instruments have their strengths and weaknesses. And I guess in thinking about the instruments, we need to be thinking about the appropriateness, the efficiency and effectiveness. Is it equitable? While there will be winners and losers, but is the policy going to be able to be shared across the community in which we're trying to influence? And is it functionally workable? You know, can governments actually apply this and implement it on the ground successfully? So again, the instrument is always got a political dimension to it as well. We can think about public policy being categorised into three types. There is regulatory. This is where we impose constraints and restrictions on the actors of individuals and groups. So things like banning the gambling advertising, that would have been a restriction. That would have been a regulatory response. Then there are distributive responses where we provide services and benefits to segments of society, the provision of healthcare services, the provision of schools. These things are distributive. And then there's redistributive policies, which are the most controversial and create the most political kind of challenges, I think, for governments. So this is where governments actually redistribute income and transfer wealth. So our taxes are really a way of redistributing. It's a redistributive policy. So who's taxed for what and those sorts of things. So for another example would be if we put a tax on sugar sweetened beverages, which there's evidence for, then that would be considered to be a redistributive policy. And of course, the health system and prevention has policies that span across all of these areas. And if we just think about policy instruments in a bit more detail again, there's also voluntary policy instruments. There's policy instruments where there's a mixture of compulsory and voluntary, and then there are compulsory policy instruments. So the First Started Rating System, which I'm sure you're all familiar with, that's a voluntary one, and I think we're desperately trying to move that towards being compulsory. But industry can choose whether to put their stars on or not. And some products have them on and others don't. So that's an example of a voluntary system. In gambling, we have limits on the number of pokies that are available in venues, and I think it varies slightly from state to state, but here in South Australia we have limitations on the number of pokies, and there are other rules in place. But a voluntary one would be that gamblers can voluntarily have nominate to register on a problem gambler registration list, which would prevent them from accessing gambling machines. And then compulsory examples are things like bike helmets here in South Australia. I think in many places in the country have compulsory bike helmets. Seat belts, of course, is another example. And of course, in the if we think about pandemics and stuff, notifiable diseases is another compulsory element. Can you think of other examples? Maybe take some time to think about other examples in the prevention space that would span across this mixture of voluntary or mixed or compulsory. But of course, then policy is also done through a number of other lenses. There's advocacy, there's a funding, there's through direct government action and through law. So this is just another way of packaging these ideas. And if we take an example like tobacco, which is obviously well understood and well known, we really need to be working across all of these dimensions to really succeed in changing the population level risk related to some of the prevention issues that we're concerned with. So if we look at tobacco, increasing the cost of tobacco is and cigarettes, and my mother-in-law smokes, and I think she bought a packet of cigarettes and it cost $75 for one packet of 30. So we've significantly increased the cost of tobacco products. So that's policy action through money. We've obviously also introduced, the world first plain packaging of tobacco products. That required legislation and actually required us to go to the international courts to fight against the pushback from the tobacco companies. So we've actually successfully won that battle for the time being. Then there's policy through advocacy, which is really social media and helping people understand the risks and encouraging them, those kind of calls to action. And then there's policy through direct action, which is the provision of nicotine patches, nicotine alternatives, and other behaviour change strategies. It's just a diagram that maps out the different levels of government engagement in the different types of policy. I won't read through it, but it demonstrates that actually all levels of government can work across all of these different types of policy instruments. And I just wanted to touch on this. So governments in my lifetime have moved away from the term policy to describe the way they decide what they do. They tend to prefer using things like strategies or action plans. And I just want to encourage you not to get concerned about the terminology. I mean, basically policy is the highest level. And then the strategy would, in an ideal world, would describe the kind of critical level actions that would be put in place. And then the action plan would provide the more specific details. But many of the policies that governments have at the moment, they call strategies. So I think, be a bit relaxed about the language they use. They're really policy documents. And here are just a few examples. They're all called strategy, but they all have visions and principles and plans on how to act. At the moment, not many of them have any policy action through money because they're not really well funded, but I think they do incorporate a number of the other things. So if we think about how do we use what are the principles that guide the use of public of policy to help support public health change. I'm going to talk a little bit now about some examples around how we can really leverage these changes, how we use evidence to inform policy, and some of the challenges. There are many challenges with that. But also I'm going to be talking a little bit about the importance of working across sectors and building these partnerships and relationships with people in other sectors to support us, to help build that coalition of voices that can help influence the government to take risky policy decisions which are inherent in much of the prevention work. And then to think about, actually, we as prevention professionals need to be really supporting the translation of research into policy and action, and how we can support that more effectively. So here's another view of the policy cycle, and you can see that it's been segmented into smaller categories. Agenda setting, getting the policy on the agenda. Evidence is really important in getting a policy on an issue onto the policy agenda. And I think it's very important that the prevention community helps to identify these emerging issues and makes government aware of them through their advocacy, through their other processes. Evidence tends not to be used, external evidence, internal evidence will be used within government agencies and policy formation, but it can also be used, external evidence can be brought to bear around what's politically acceptable, what, how you can bring the community along, and whether you can actually act in taking a more hardline policy, such as a law or legislative response, or whether you need to use softer policy instruments. Of course, implementation, we really need evidence to tell us whether what we're doing is working once we've done it, and how best to make sure that we're implementing it as effectively as we can. But where evidence is often used and regularly used by governments is when they want to work out whether a policy or a strategy is working. They bring researchers in and they use evidence to determine its impact. And I think sometimes governments do this when they've decided they might want to change the policy or remove it or reduce funding for it. So that can even in and of itself be a political dimension. And I think how we frame the problem, as I said earlier, really influences how much we can bring evidence into all of these issues. If we can keep the policy window open and we can keep the balance of all the different influences, we can really bring the evidence required to lead to the policy change that we're looking for. I guess that last point there is how we define the problem will really determine what the solution is. And so thinking thoughtfully about the problem and how it can be defined in a way that will work within the current government's political processes and priorities will be really helpful. But of course, what often happens is researchers, and I'm sure you've all had this experience, will bring a report to government that'll be like 30 pages long with lots of technical terms and no clear advice around what to do. Governments want evidence to help inform their actions. They certainly don't want researchers saying to them, actually, we've done this research and we've identified these issues, but actually we need more evidence. We need to do more research. That drives governments and policymakers to distraction. So it's really important that if you really want to help governments shift and act on policy, and there's a policy window open, then it's really important to provide your evidence in a way that gives clear advice to government and helps them make those decisions that we want them to make. And so at this diagram here, it's really, I mean, in government, and many of you will know this, ministers might only read 3 dot points. They may not go through all of the detail. So you really need to be able to capture and summarize what the problem is, why they should act on it, what the evidence says, and what the recommendation is as pithily as you can. And then if we think about needing to work across policy and working in policy, if we're thinking about primordial and primary prevention action, many of the things that create health and wellbeing are completely outside of the health sector's influence and ability to shape. and is not even in the mandate of the prevention community. We need to be working with systems and sectors outside of the health system. And so here, the evidence would say that we need to be working across sectors. We need to be working with other parts of government. And I'm going to talk a little bit now about health and policies. If I can get the slide to move. Sorry, it's not moving. Just give me a minute. Typical. One of my favourite areas to talk about, and now the slide's not moving. I wonder why that is. Oh, here, let me try this. That's working. That's not working. I will. Well,
yeah, Carmel, excuse me, Carmel, it's Karen here. If you wanted to stop sharing, I can share and try for you.
Okay. Well, perhaps we could stop there, and I'm just thinking about time. I mean, I can talk a little bit more, but we could. It's not letting me stop share either. Oh, here we go.
Just be. Yeah, we do have 3 to 4 minutes till we want to kick off a Q&A session. So.
All right. Well, let me try again then. Let me just try and see if I can share again. Where was I? It's not letting me navigate very easily. Okay, you be in control, Karen. So while we're waiting, maybe what I'll do is I'll just, so basically it's important if we want to influence policy, we need to bring other sectors of government along with us, because if many times the policy levers we want to pull to support prevention, if we don't frame them in the right way, will be seen to actually create losses, and we'll be the winners and the other sectors will be the losers. And that doesn't lead to, that minimises the success and chances of many of our prevention activities being approached and implemented. So health and our policies is really about recognising that we need to work across sectors. We need to build these trusting relationships with policymakers and decision makers and other government agencies. We need them to understand how their decisions influence and shape health and wellbeing outcomes, and to be working with them in ways where we can find win-win solutions to these problems. And health and our policies provides a framework to do that. It talks about structure and setting up whole of government structures and systems to enable to bring the different sectors together. It identifies that we need a mandate and leadership. Excellent, clever, thank you. And so really the health and our policies approach is recognising that that really we need these co-benefits, and that that problems are interconnected. Many of our prevention problems can't be solved by us alone. Next slide, please. So there are 4 critical success factors really that we understand that really shape and influence healthy public policy, which you all know is one of the 5 action areas of the Ottawa Charter. Good governance for health. So this is really about having a whole of government approach to acting on public policy decisions, not to have a siloed approach, not to have the Transport Department having a policy decision that is bad for the Health Department and vice versa. It requires the development of strong, sound partnerships. We need to be bringing policy actors from the different sectors together in ways where they can build relationships and actually trust each other. Government tends not like to disclose problems that they have outside of their core agencies. So we need to be providing these really helpful, building these relationships where the prevention people can be brought in early, and the issues that the other agencies are suffering from and struggling with can really be shared. But to do that, you need to have trusting relationships. To work across sectors requires dedicated capacity. It's fine, move on, that's great. So that next diagram is really highlighting that. I love this diagram. This is really a description of what we're trying to do through getting healthy public policy embedded into our government agencies. On the left-hand side is coexistence, how government departments tend to operate now. And we're trying, through a health and a policies approach, trying to move them across to the collaboration where there's a shared responsibility, there's formal partnerships, there's working together on common goals. So these are the things that we're trying to achieve through a health and a policies approach. Next slide, please.
Yeah, Carmel, that's you still sharing.
Oh, is it?
Yeah, that's me. But
All right.
is that
Oh,
not
sorry, Michelle.
moving forward?
No, actually, let's. I think. Look, I mean, I think the other section of the slides that I was going to talk about was the translation process and the importance of translation. But I think, maybe we should go to the questions, given the slides are not working for us. This is just.
Go ahead, Carmel.
I just was going to suggest that this is the 4 pillars model, which has recently been released by the World Health Organization, which is at its heart is about how to work to create healthier populations and address equity. And the next slide has a bit more detail, but it also has a link. So if we move through to the slide after that, I think if you want to go to that link, you can find out more about the health and a policies process and the way the World Health Organization has been considered, how we can apply it. There are some good examples in Australia around how these ideas are really being taken forward. Tasmania is, for example, been applying a health and a policies approach, and South Australia has had a long history of working in this space. And there are many, many documents where you can find out more about how South Australia has gone about applying a health and a policies approach. But this document is probably the most up to date. I won't go into the research translation in the interest of time, but just to advocate that actually as policymakers, as community people working on the community sector, as researchers, we really need to invest in planning how we translate evidence and use that to inform policy making, and which can then shape impact. And so I think it's not done well enough anywhere at the moment. You all probably know it's on average 17 years for evidence to inform policy. And so, it's something that we all need to be working towards a bit more. It's a lever that we can pull and strengthen in the prevention community. But let's leave it there. So there's time for questions.
That's great. Thanks, Carmel. I will stop sharing from my end. Right, great. Well, thank you so much, Carmel. That was very insightful. A lot of ground to cover in a very short time, but I'm sure we can unpack some of those things in the Q&A. So I will go to the chat. I can see some people have been commenting here. So Nicole, would you like to jump on the mic and ask your question, or would you prefer me to read through it? Right, I can't see Nicole in the room, so I'll just read what she's posted. It says, what I've found in the advocacy that I've been involved in to date is that many politicians are unable to accept or understand social determinants of health, and also maybe unable to manage complexity. I'm lost as to how to get around this. So any advice on that, Carmel?
Well, I think actually, yes, I think it's recognizing that governments aren't just put into power by the community to act on health. They have many other jobs that they have to do. And so I think as health prevention advocates, we need to find the balance around how we communicate and how we push our agendas forward. And we need to be thinking about the timing. So you may well have all heard of the a policy window. It's when you get a policy window in public administration. They talk about the policy window, Kingdom's policy window. Feel free to look it up. It's when you get an alignment of the politics, of the policy issue, the policy solution and the problem solution, and they all align together through that policy window, and you can really get significant change. So it's not incremental, it can be exponential. But I think as prevention people, we need to be watching for those policy windows, but recognise when they're not there. So if at the moment the politicians aren't supportive and you can't get through to them, then maybe this is not the time. But don't give up hope. We need to be tenacious as prevention people. We need to keep working on these things, and then eventually we can see change. But I think you need to be mindful about understanding the political cycle, understanding the political process, and working out when you should move forward to push on that policy window and that agenda. I hope that's answered a little bit.
Carmel, just to follow up on that, are there any effective ways that you found to navigate those policy windows or to identify them and grab them when they do open up?
Well, the first thing I would say is, as prevention people, if you're working at the state level or the local government level or the federal level, or you're a researcher, you need to understand what are the political priorities of the governments of the day. So make sure you're familiar with their ideological platforms, what are their election commitments. Be familiar with those things, because that will help you identify, is there a policy window for your agenda in that space, and which party, is it an independent, is it one of the major parties, which parties are interested in the work and may be able to be influenced by your agenda. The other thing I would suggest is build coalitions. And I think if you're outside of government, it's easier for you to be stronger advocates, but having a coalition of support, build alliances with others with like minds. That TAPSI is a fantastic organisation to be able to help you do that, and then you can use the strength of force, the strength of numbers to help get your argument over the line. The other suggestion I would have is understand who will be arguing against you, who will be fighting to not have what you're pushing forward. What is their agenda? What are the arguments they're using to counter argue your case? And can you see any weaknesses in that? So understanding, I guess, understanding the position and arguments of your enemies is really important to being able to work out how you can undermine those arguments or move around them.
Thank you. The next question is by Peter, who asked that you spoke about the difference between external and internal evidence. Could you explain a little about what the difference is and what or when governments prefer either one of those?
Well, governments tend to be risk adverse, and so they won't seek, so governments, what I really meant by that is governments don't like to disclose the problems that they have outside of the safe environment of the government agency that's tackling the problem. They will seek evidence when they think it's helpful, but oftentimes problems will be determined internally. And external agencies won't even know that policy issue is being discussed or put on the agenda. And so I think understanding that is important. And so for those of us internally in government, we need to be the ones that are looking for the external evidence and making sure we can bring it to the table to help and bear and influence the decisions. Just to give you a little example, about 10 years ago, we were invited by our current Premier at the time to help decide whether South Australia, you may know, is on the half hour, and we're only one of 2 places in the world that's on a half-hour time zone. And there was great pressure from the business community for South Australia to align with the Eastern Seaboard. And so our Premier approached us and asked us to provide some evidence around the decision to whether we should move to the Eastern Seaboard or not. And we had 3 days to do that. And so you can imagine there's very little evidence around moving someone on the half hour, moving times. And so we did manage to find some evidence, and the Premier decided not to do it. But I think that's just an example. But nobody external to government would have known that that was actually a decision that was being made at the time. So that's just an example. And I think for researchers outside of government, they need to form relationships with policymakers and practitioners who are in government, develop those strong collaborative policy relationships where the policy people will come to you and seek your advice, and then you can leverage those relationships when you want to share your evidence that you're gathering.
Great. I think we have time for one more question. So I have the next one by Concita in the chat. Concita, do you want to try using your mic?
Yes, that's fine.
Great.
Hi, Kamal. Thank you for your presentation. It's been really insightful. I just recently read a report, and these are interviews with senior UK ministers about obesity prevention. And one of the striking things that I read was that trying to get intergovernmental policymaking is virtually impossible because inevitably someone will shut it down or water it down and so on. So I'm just wondering whether this is your experience as well in Australia. And I think where I am, I'm not sure whether health in oil policy is a formal mechanism. And if so, if there is no that formal mechanism, how can we actually influence health agendas in other sectors?
Yeah, I think, look, there's plenty of information in the public administration literature that says joined up policy making is impossible and it can't be done because governments are operating in silos. But I think that's not acceptable. And there are examples internationally where governments are doing this joined up work. It means that governments have to change their culture. They have to move away from having just vertical silos to having both horizontal, they need to engage horizontally as well as work vertically. We want hospitals to run well and health systems run hospitals well. We want schools to run well. So the vertical nature works with those kind of problems, but it doesn't work for our prevention problems or many, many broader societal problems. We're not going to address climate change and we're not going to address inequality if we stay in our silos. So, and there is evidence that you can create incentives. And just to let you know, tonight I'm going to be talking to the UK because the UK government is really interested in looking at multi-sectorial action. And multi-sectorial action is being pushed by so many different UN agencies. It's embedded in the Sustainable Development Goals in terms of Goal 16 and Goal 17. And, One Health is talking about multi-sectorial action. So I do think there are many problems, many problems. But I also think that we have some evidence around what are the things that need to be in place. How to get started if there's not an appetite, how other places have done it is they've run training courses or they've developed a report. It's creating the political agenda where that you can get a bit of interest. Like in Tasmania, it began because there was strong advocacy from a non-government organisation that lobbied for 10 years. So it's that persistence and tenacity. And they're now doing amazing things. So I think it's also been thinking about how we frame ourselves. I think as prevention people, we often come across as very health imperialistic, like health is the most important thing, nothing else matters. And that really shuts down the conversations when you're trying to build collaborative agendas with other government agencies. So thinking about how we present ourselves, how we engage as partners, and how we present the problems, and not not always making the perfect solution, the perfect prevention solution, the enemy of any other good options that we might be able to get on the table. I don't know. Kaniska, has that answered your question?
Yeah, that's helpful. Thank you. I think the message is that we need to push for it. Yeah, thank you.
Yeah.
Sita, and thank you, Carmel. I can see there's still some unanswered questions in the chat, but we have run out of time. So, Carmel, I'm not sure if you have time to answer those right now, or if you want to stay online, and we can say goodbye to the participants who want to leave. Otherwise, we can follow up with you if you still have any questions that remain unanswered. You can reach out to us at the Prevention Center, and we can try to get all those questions answered through Carmel at a later time. What do you think, Carmel?
I'm happy to stay on for another 5 minutes if that's helpful.
All right, so I think let's just continue then for 5 minutes. For those of you who are wanting to leave, thank you so much for joining us. We will see you next time in the new year. Bye, Nadia. And yeah, so we'll continue with the questions. The next one is from Deanne. Deanne, would you want to see if your mic works?
Yep, sure.
Great.
Can you hear me?
Yep, perfect.
Yep. So my question, Carmel, is we've just had a Conservative government elected in Queensland, and it's very early days, so we're not really sure within the health department, you know, we know that the focus is going to be on building clinician workforce, frontline services, etc. When you read through their health plan, it's all about, you know, hospital ramping, reducing waiting lists, making sure that the care is in the right place at the right time, and there's just not one skerrick in there about prevention. So do you have any suggestions on how to keep prevention on the policy agenda for a Conservative government at all?
Yeah, what I'd suggest you do is look at their other policy election commitments, you know, with their other policy priorities, and identify where prevention may be connected. Some of the things we did when we were implementing health and health policies in South Australia was we would take the policy priorities of the government of the day, and we would cast a health lens across them and describe the interconnections between their agenda and determinants of health and prevention, and map that evidence out for them, and even identify opportunities for policy levers. And that really seemed to have quite a big impact. You might be remembering, I think Queensland and South Australia went through a pretty similar process in 2013 where we lost lots of our prevention workforce. I think South Australia, we haven't really recovered we're recovering, we're building now. But I think the health and the policies process stayed alive because we did that mapping. I don't know that you'll be able to change the health system. I think we haven't been very successful at reorienting. I'd go elsewhere. I'd look at the policy priorities. You know, are they talking about well-being in education? Are they talking about are they talking about cycling and walking? Probably not, but in transport. You know, are there, and think about, don't you focus on the kind of traditional prevention strategies. Think about what are the foundational elements we need in our communities. You know, is there a livability dimension, and then how is prevention supporting livability? You know, I don't know what words they're using in Queensland, but I'd look for words and I'd try to draw those connections to the prevention agenda, and I'd pivot. If prevention's not possible, I wouldn't call it prevention. I'd call it something else, just to keep the ideas moving and flourishing. And if you're outside of government, I'd start to build those coalitions. I'd be operating at multiple levels, if you could.
Thank you.
Thank you. So the next question I can see is from Peter in the chat. Peter McHugh, do you want to jump on the mic?
Yep, thanks, Michelle. Thanks, Carmel. Terrific summary. I'm kind of curious. I've done a little bit of interagency work, and it seems to have its moment and then fade away. And and I'm kind of curious from your experience, particularly from a health and oil policies perspective, when it fades away, and invariably the structures are there in the institutions can't cope with that interagency collaboration. It can for a period of time, but then people move on, and it's just the institution doesn't support it. How have you tried to address that? And I think you kind of addressed that with the Queensland question, but was there anything particularly focusing from an interagency perspective that you've seen over time be able to sustain those relationships? Because it seems the government agencies want to do it, but the institution doesn't support it.
Yeah, I think that's nice. I agree. I think there aren't incentives for the so for the whole of government, like for the political party, there are incentives, but perhaps for the bureaucracy, the incentives, it fades when the political leaders that have the mandate and support for it change. We've definitely had that experience in South Australia. I think one of the things that we did was we really, and I know this takes time, and I'm not trying to be Pollyanna-ish about it, but it's really taking the time to build those informal relationships. I often joked that when I was doing the health and our policies work, I spent most of my time in coffee meetings, catching up with people, building relationships. And in a small state like South Australia, it was possible to really form connections across multiple sectors. And then we just maintained those things when there was less political support for the initiative. The other thing is, so informal networks is really important. I was going to say something else and it's escaped me. Sorry, it'll come back in a minute, hopefully. But yeah, those informal networks and no, I can't remember. It was very insightful, but I've forgotten.
No, that's great, Kamal, because that's exactly my experience too. I've just maintained those relationships informally. That we're in a trough, waiting for the wave to come back, and then build on them when the wave comes back. Thanks very much.
The other thing I was going to say, I've remembered my brilliant idea, is be useful. Is do something useful for them. So that, and I'm sure, Peter, that's what you're doing. But I think keep the networks going and be useful. I think that's also how we've really maintained those connections.
Thanks, Kamal.
Thank you, Kamal. I think that is everything. So thank you so much for your time today and for sharing all those insights and all that knowledge with us. We really appreciate it. And thank you to all the participants as well for being engaged and for asking all those thoughtful, thought-provoking questions. We will share the recording through our networks at a later time for those who have said that they missed out on bits of it. So, and I'm sure that you can connect with Kamal on, her socials where she's active and engaged, and learn more about her work through those channels, and also stay engaged with the Prevention Centre and the Emerging Leaders Network, because we will be bringing you more events such as this next year. And thank you to our members for a great year, and yeah, good luck. See you next year. Happy holidays.
Bye, everyone.